So the first question is for you, Jalish. And it comes from a 32-year-old woman who was diagnosed with MS last year after initially having problems with her vision. So she says, now I found out more about MS, I'm worried that I'm also going to start having problems with my bladder and bowels. Can you explain how MS causes these kinds of problems and how likely am I to develop them?
Well, it's interesting that though the bladder and the bowel are opposite poles to one another, actually in health there's a very tight control of bladder and bowel functions from the brain. And in health, it's essentially the bladder is sort of inhibited. So when you're on the high street or when you're at work, you really don't want to be bothered by the bladder unless it's really required. And so signals from the brain go through wires through the spinal cord and reach the bladder and the bowel and keep those organs inhibited. Now what happens is when these wires are damaged, say multiple sclerosis, the wires don't work the right way, the signals don't reach the way they should. And as a result, bladder problems start arising, bowel problems start arising, and though we say that perhaps if we look at individuals with MS as a whole, generally maybe 3/4 of individuals will report bladder problems. It generally depends on the duration of the MS and also the level of disability associated with MS. However, 1 in 10 individuals with MS will report bladder issues at the time of their initial diagnosis. And hence I think it's critical that it's asked at the very first meeting, are there bladder issues, so they can be addressed and properly managed.
And can you predict from how somebody first develops their MS whether they're likely to have bladder problems or not?
I think it's extremely difficult to do so because originally we used to think that if there's spinal cord problems, then it's likely that there will be bladder issues. But we now know that it's not just problems in the spinal cord, but say if there are plaques of MS, say in the brain, for example, then there could be problems with the bladder. I think it's just awareness that the bladder can be sort of involved. So if an individual has problems with, say, going to the toilet often or feeling urgent, rather than sort of trying to flush that thinking it's some infection, it's to report it to someone so that it can be addressed appropriately at an early stage.
Right. And so from a nursing perspective, what's your experience about how frequently and the types of problems that people have?
I think in the majority of patients that we see, certainly they'll be going to the toilet more often than their friends, and that's usually if somebody's not too sure how often they are going to the toilet. Obviously, do you notice you go to the toilet more often than your friends are going, even though that can be very individual, or if you're getting up at night time, whereas before perhaps you weren't getting up at night time. And also, the majority will say they have to rush to the toilet, they're worried. The biggest thing that most people will say to us is they know every toilet on the way to the supermarket, or they don't go anywhere without knowing where the toilet is because they've noticed that is a focus in their day-to-day life, is where is the toilet.
Yeah, I agree, but I think quite often the general population will have quite a few bladder symptoms anyway. I think it's just when you've got you've got a long-term condition, sometimes those symptoms become more difficult to manage. So, I find most people that come into clinic will have some kind of symptom, be it needing to go urgently or needing to go frequently.